Does testosterone slow biological aging or reverse it?
Very important topic.
Yeah. And the difference between biological age and chronological age and whether testosterone is helpful for that.
Mm-hmm.
So here's the story. For my whole career, lifetime, we've been talking about how old is a person, right? And that's your chronological age.
Yeah.
It's like I was born in a certain year, I'm this many years old. We can't do anything to affect that. But there's been a concept in medicine and in research about biological age. So it's almost like, okay, you may be born in a certain year, but your body may be older than that or younger than that. And that's really what we're talking about with biological age. In medical school, as we were learning how to write notes about people and observation and physical exam, the first part of physical exam is observation, and you write it down. It was common to write something like 42-year-old male or female who looks older than their stated age or younger than their stated age, right? Like we already had this concept as if it were meaningful. Now, I don't know if they do that today, if they're taught to do it, but it was believed that there was...
Before we start, a small disclaimer. The Sex Doctors podcast is not a substitute for medical or psychological advice.
Welcome to the Sex Doctors, featuring Dr. Marianne Brandon, clinical psychologist and diplomate in sex therapy, and Dr. Abraham Morgentaler, renowned urologist and expert in sexual medicine and testosterone therapy. Together, they bring you expert insights into sex, intimacy, and relationships. Let's dive in.
I believe in miracles. Where from?
meaning to that. Certainly people can feel older than their age or feel younger than their age.
For sure.
And people want to be younger. So it turned out that this biological age can be a predictor of how long you're going to live, better than how many years you've been on this planet. And it's also a marker and an indicator of the likelihood of getting different diseases or chronic medical conditions. That's important.
Very important.
Yeah. So, and some of this may be new to people listening in, but may not be. So, there's genetic basis of aging, right? Like some people have parents, everybody lived into their 90s. We usually think that's predictive, and science has shown that it is, of living longer yourself. Some people, their parents died earlier. It doesn't mean that you're going to die early, but it means you've got a genetic predisposition to that, and you better pay more attention to your health and all that. We then have epigenetic factors, which is your DNA doesn't really change the important backbone part for you, but genes can become altered, methylated, almost as if they're being turned on or off. And so we have an ability to look at that. And you can have organ-specific disease. You've heard people say, oh, like somebody's been drinking. I saw the doctor. I've got the liver of an 80-year-old, right? Not good. Not good. We can measure blood vessel aging through, as people get older, they get stiff blood vessels. And you can look at that. And then we have the big question of, can treatments of some sort change your biological age? And one of those that I want to bring up here to discuss for a moment is testosterone. Can testosterone improve biological age? And often with biological age, we're looking for the difference or the delta between your actual chronological age and what these markers or indicators of biological age are saying. In other words, are you likely to be healthier than what your age is saying, right? And so they've done this in all sorts of different ways, but I just want to say that in the office, when when men came in and they had testosterone deficiency, they didn't always know it. But as you're talking to them and interviewing them and asking about symptoms, they would often say, I just feel old. My wife says I've become a grumpy old man, right? And you might hear this in a 50-year-old. They're not old, but they feel old. their people around them perceive them as old. What's the difference? Well, a lot of it has to do with sense of life, vitality, energy.
Yeah.
Right? The guy says, I used to come home from work at the end of the day. It didn't matter how busy it was, didn't matter how stressful. And I was ready to go out for drinks with my buddies or to play squash or whatever it is he plays or go out to dinner with my wife. Now I just want to come home and do nothing. I want to just sit on the couch and watch TV. I feel old, right? We associate these things. And if people have low levels of testosterone, testosterone deficiency, and we treat them, a lot of that vitality and pep comes back. This isn't anecdotal. This is actually shown by large randomized controlled trials. People have more energy. Some of their aches and pains that make them feel old diminishes.
Isn't that fascinating? So you're saying that with testosterone supplementation, people who were originally low in testosterone find improvements in their aches and pains.
Absolutely.
Isn't that something?
Yeah, and the pain doctors have now discovered testosterone.
I didn't know that.
In order testosterone therapy.
Oh, wow.
I've had patients, so a lot of people take testosterone. Once they're on it, they don't have to stay on it forever, but they usually stay on it for a long time. And I've had patients who, I'd ask them at their yearly follow-up, or they've been on it for 2 years or 3 years, about how they're doing with the testosterone. Because sometimes we have to adjust dosage of what they're on based on how they're doing. Bodies change. And I've had several men tell me, well, I don't take it all the time. When I'm traveling, it's just not that convenient. But I know I've been off it too long when all my aches, when my joints start bothering me.
Wow. Wow. What about things like sleep? Can testosterone impact sleep?
Interesting relationship with sleep, because low testosterone levels are often cause bad sleep. And what some of the guys say is that once they get treated, I'm sleeping so much better.
Which is so important for this whole concept of your biological age. We hear this all day long, don't we? That sleep is like point number one to staying healthy.
Yeah.
So if testosterone can help someone, if they're low in T, and it can help them sleep.
Yeah. And then there's this circular kind of relationship where any kind of bad sleep, impaired sleep apnea, for example, is a common example, can lower testosterone. So bad sleep can contribute to low testosterone levels. And when people have low testosterone levels, it impairs their sleep. Yeah. So biological age. So I just want to say doctors hate this. Anything, if a doctor hears, this thing is going to make you younger. Yeah. And some of the ads that are out there now, like on social media and stuff, it make me so uncomfortable.
Yeah.
So fortunately or unfortunately, there's some truth to some of what is being described. And I want to talk about the science behind some of this stuff.
Okay.
But when doctors hear this thing is like anti-aging, there's an immediate reaction. We were trained in medical school to be suspicious of anything that sounds like that.
Because at this point, you can't stop aging. So this anti-aging, it's a poor use of of words, I think, that can sort of set it up for people to feel like it's snake oil.
Well, the history of medicine is that there were things like snake oil.
Yeah.
So, somebody listening may be saying, what's snake oil? Like, especially younger people. So snake oil was one of the things that were used, these elixirs. They're often called patent solutions, patent elixirs, where people took a little bit of this, whatever it was, and it often had exotic sources, right? Like the horn of a rhinoceros or something like that. Yeah. And it was supposed to have these miracle cures, none of which were ever demonstrated, and were all BS, of course. So doctors hear that, and even what we're talking about here makes me a little nervous to even share, because I don't want to be regarded as sort of fringe. I've always been fighting that.
Yeah.
But here's the thing, it's scientifically based now.
Yes.
So there are a couple of studies. One of them is looking at this is a 10-year-old study from 2014. First author is Shu, HSU. Testosterone increases renal anti-aging Klotho gene expression via the androgen receptor-mediated pathway. It's in the biochemistry journal, and that sounds like a technical thing, but basically there is a gene called Klotho, Klotho, that makes a protein, also called Klotho, same spell. And it's been shown that it is it's an aging suppressor gene.
Aging suppressor. I want to get me some of that.
Yeah, exactly. So more Klotho is better for you in terms of aging. And basically they did studies in animals, that's in vivo studies, and in test tubes with cells, those are in vitro studies, and showed that this protein that's made by the kidneys actually is upregulated. There's more of it in the presence of testosterone.
Wow.
Testosterone upregulates that. So that's one. There are other studies that have looked at epigenetic age. That's where they look at methylation or these changes to the genes themselves. And DNA methylation-based studies. There's one by Custers and coworkers from 2023 that higher testosterone, or this is interesting, a greater ratio of testosterone to estradiol, like more testosterone for the amount of estradiol, that ratio was associated with decreased epigenetic age and mortality risk.
Decreased mortality. This was all, I'm assuming, just with men. Is that right?
Yeah, us as men. And there are other papers, Zhang and others in 22, Glover and others in 2024. There's a whole science of biological aging, and a subset of that is about how testosterone can benefit, improve biological aging, make the difference between your actual age and your biological age look better.
Now, I know most of this, if not, I'm not going to say all of this research, but most of it's been done for men. Can women expect that testosterone would give them similar benefits?
So not very well studied in women because we just have much smaller numbers of testosterone therapy in women. And we still, even though there's good evidence that women get a lot of benefits from testosterone when they're deficient, just like men do, we have no FDA-approved testosterone products for women, which actually makes it harder to do research.
Yes, absolutely.
You have to get all this research generally through, these IRBs, these institutional review boards, human subjects committees. And if you're using an off-label treatment, that's just one other hurdle to get that approved, right, and funded, right? So it's harder to do it.
Yep.
And so really all I'm saying is there's a line in a book that I love. The book's called The Male Hormone. It was written in 1945 by this guy, Paul Durqueef. It's about the development of testosterone, the early studies with it. And he says something along, and I'll paraphrase, there is nothing so hidden and obscure as something that is obvious. So when the men say, I feel younger, when we have studies that argue that biological aging is improved with testosterone therapy, when we see men who say without testosterone therapy, it's just when they come in that they now feel like they are old, and we see them improve with testosterone therapy, the proper modern skeptical stance is, well, it's not really about aging. In fact, the science is telling us that there's something really important about that process and about testosterone therapy. So here's some stuff that's associated with low testosterone. And I want to make the point that there's a lot of focus, understandably, on the pros and cons, risks and benefits of testosterone therapy. There's very little discussion out there about the problems associated with having a low testosterone level. It's not, most doctors don't even recognize it as a condition, testosterone deficiency, or they think only of the most severe cases. In fact, we have great science on this. So low levels of testosterone predict with double or 3 times the risk of getting diabetes, type 2 diabetes.
So wait, let's just repeat that. Low levels of testosterone dramatically increase the risk of getting diabetes. That's what you just said.
And obesity.
And obesity.
and what's called the metabolic syndrome, which is a couple of items like high blood pressure, high HbA1c, also associated itself with cardiovascular risk. They predict this by a factor of 2 to 3. It's unbelievable.
That really is.
Right?
Yeah.
Low levels of testosterone contribute to and are associated with low bone density. Low bone density, like osteoporosis, increases the risk of fractures soon or possibly later in life. And some of these fractures, like a fracture in an hip fracture in an 80-year-old man, has a 50% mortality rate.
Right. So it not only makes you it not only makes you feel horrible, it does advance your biological age pretty dramatically.
Absolutely, and specific risks for certain problems, right? And in terms of heart disease, we got totally focused for the last 10 years on this nonsense thing about testosterone therapy increases heart disease, now completely disproven with a large study. But it made us forget about what are the known risks of having low testosterone for heart disease. So in populations where they're not getting testosterone, they're just measuring testosterone levels in a population, right? Like they get the Framingham study, people have often heard of, San Bernardino. They look at these groups, and it turns out that the men who had the lowest levels of testosterone compared to men who were higher had increased risk of getting coronary artery disease, increased severity of coronary artery disease, increased mortality.
Low levels of testosterone, these men had all of these increased risks for this is very dangerous, these medical problems that are very dangerous. They're not benign.
Yeah. You know, when I teach, I have a slide that I like that sort of puts a focus on how important testosterone is, a testosterone level, for understanding the health of men. This is all about data really about men. Women can benefit from testosterone too. We're talking about where the most research is around men. So, you know, I believe it's the single most important blood test that a doctor can get on a man to look at their health status.
But not just a total testosterone. That's not at all what you're saying.
Well, there are benefits of free testosterone to talk about versus total. But let's just stick with total, which is what most doctors get.
Okay.
If you just look at total testosterone, you find out about the associations with diabetes, obesity, bone density, right? You learn about all these different things. Almost any other blood test you get. What does a doctor get? Glucose? Well, it's good for some specific things, right? CRP is like a marker of inflammation. Okay. Like they're all valuable as pieces of the puzzle. But if you could only get one blood test, I think the most important would be a testosterone level. Free is better than total, but I'll accept total. That's what the data show us. In fact, low levels of testosterone are associated with, hold on to your hats, ladies and gentlemen, aggressive prostate cancer.
Low levels of testosterone are associated with aggressive prostate cancer.
Aggressive prostate,
which is exactly the opposite that most of the people I know believe. I'm not kidding you. Most of the professionals or non-professionals that I know would think the opposite.
And almost all urologists have been taught the opposite of what's true. So Gleason 8, 9, and 10, which are the most aggressive prostate cancers, associated with very low levels of testosterone compared to men who have less aggressive cancer. Unbelievable.
Really unbelievable.
Yeah.
Absolutely.
And in fact, there's a great paper by Stacy Loeb and her Swedish colleagues where they have all the data from Sweden, which, you know, socialized medicine. They've got health records on everybody. And they looked at men who got testosterone compared to men who didn't. And the rate of prostate cancer was similar in the two groups. But the men who got testosterone had 50%, half the rate of aggressive prostate cancer.
Wow.
It's unbelievable.
It really is unbelievable.
So, this is what we got. Testosterone appears in multiple studies to improve testosterone therapy in men who are deficient, to improve biological aging. Is it anti-aging? That term has so many daggers that come with it. You know, daggers coming my way, but that's sure what the data are suggesting.
And when you're saying biological aging, you're also talking about appearance, not just internal organ aging, for example, but testosterone increases collagen, right, which can diminish the look of wrinkles. So exterior, too, can be impacted, not just interior of the body.
Increases muscle, decreases fat. It's pretty good.
It's pretty good.
Yeah, and sometimes the men will say, it's my wife or my partner that says I look better.
Mm-hmm. Mm-hmm.
They may not even notice it themselves.
Right.
But you do.
Now, it's not uncommon for me to hear someone say, if I go on testosterone, I'm going to be on it the rest of my life, and I don't want that. I hear that pretty regularly. So you must also hear that pretty regularly.
One of the criticisms of testosterone, or one of the rationales of testosterone skeptics, is to say, well, I don't, I'm talking in the medical field, to say, I don't want to put somebody on testosterone, because if I do, he's going to be stuck with that medicine the rest of his life.
Right.
So first of all, that is total nonsense. People stop their testosterone all the time. In fact, I think what's reasonable about testosterone is for it to be suggested to patients as a trial. Try it.
Well, that's, absolutely what I say to mine as well. Like, gather more data and figure out what you're saying no to. So give it a shot, see what happens.
Yeah.
And let's put a date in the calendar. Find out how long your doctor suggests you need to be on it to have a reasonable experience on the testosterone to know. And then assess it at that time. If you need to be on it for 3 months, then let's look at 3 months and see. Right.
So I think, a reasonable trial is somewhere between 3 and 6 months.
I see.
Less than 3 months, I don't think you'll necessarily know what's going on. It takes often a good month before people even notice some of the changes. But absolutely. So, it's not for life, even though, curiously, I have a book called Testosterone for Life. But that's not meant to suggest that somebody has to take it for life. It's supposed to be, it's another loaded term, it's pro-life.
Oh my.
But not in the abortion context. It's just pro-living and health and
pro-vitality, let's do it that way.
Yeah.
Yeah. Now, what about the men who are concerned about their fertility? Because that is an issue with testosterone. It can impact fertility. And I have to believe that's part of why testosterone can get a bad rap, is that people can think, well, if it's bad for my fertility, how can this be good for me? And how can it be anti-aging?
Right. So that's true. So if we use regular testosterone, we call it exogenous testosterone, an outside source, whether it's a cream, an injection, a pellet, a pill, it actually decreases sperm count.
So that doesn't sound good.
No. For most of the people that we're talking about with testosterone, they're probably already through their reproductive years. But if you get the 30-year-old or 35-year-old who's still interested in that, we still can treat them, but we don't treat them with pellets or creams or whatever. Because it can lower their counts. But we do have treatments that can both support sperm production and raise testosterone. And there's interesting new data around, one of the newer forms of treatment of testosterone, the oral forms, pills, and they seem to have less effect on the sperm production.
Oh, that's interesting.
They don't decrease it as much. And so one of the evolving strategies is about, can somebody go on, and there's research being done on this, can men go on the orals and still be able to conceive?
Okay, I have a question for you in that so often when we do a show that you discuss testosterone afterward, people ask questions. How do I find a doctor that does this, that knows this? So what do you say to them? Because we get that question all the time.
Yeah. So, my recommendation is I belong to a group within the American Urological Association called the Sexual Medicine Society of North America. It's abbreviated SMSNA, and their website is smsna.org. And those doctors who are involved in sexual medicine, by and large, are pro-testosterone, like they've seen the benefits, they know the research, it's good, and they're willing to offer treatment.
And they know how to get a good level. Like we're not really getting into that today, the total T versus the free T. But most of the docs in SMSNA, they know how to do free testosterone.
Right. And there's a place on the website where you can actually identify a doctor that belongs to that organization that's in your geographical area. So that's useful.
And if that strikes out, There's always A4M, the docs with A4M that are.
So there's a couple of groups that call themselves either anti-aging or age management. And those groups were the first really in the modern era to discover the benefits of testosterone therapy back in the mid-1990s and on, even when sort of more mainstream type doctors were still reluctant. That's still true to some extent today, but those types of doctors do tend to be embrace the issue more and are usually skilled and adept at offering this. So those are two good places to start. So there you go.
There you go. Well, and we will talk more about women and testosterone because we didn't address that too much today.
We love women.
We do.
And women need testosterone too, or often they do.
Yeah.
Yeah. Especially after menopause. So they can get a lot of benefits too. But that's an interesting topic that deserves its own discussion.
For sure.
Yeah. So listen, if you like this content, give us a thumbs up, subscribe, write us a review, and we hope to see you again on another podcast of
The Sex Doctors.
Bye-bye now.
Thank you for listening to The Sex Doctors with Dr. Marianne Brandon and Dr. Abraham Morgentaler. Be sure to subscribe, leave a review, and tune in next time for more expert advice on sexual health and relationships.